A 3-minute introduction to the Miller-McEntire Periodontal Prognostic Index, or the MMPPI. This index is evidence-based, it is statistically validated, it's accurate, it was published in the Journal of Periodontology in February of 2014, and in 2015 it was awarded the Clinical Research Article of the Year. It's based on the scoring of 7 factors: age, diabetes, smoking, molar type, probing depth, furcation involvement, and mobility. For furcation involvement, it is the number of furcations involved, not the classification. And probing depth is used rather than clinical attachment loss because the study is a retrospective study that was completed in the early 1990s before the term clinical attachment loss became popular. Here are the various scores assigned for each factor, and more details can be found on the background and development video on the web textbook. So therefore, if we have a score of a 5, the patient has a 93% chance of keeping the teeth for 15 years in health, or an 80% chance of keeping the teeth for 30 years in health. But here's some pertinent facts that you need to be aware of. First of all, patients who smoke compared to non-smoking patients with the same level of periodontal disease have a 246% greater chance of losing their teeth. Let me tell you, when you share that fact with patients, it is very impactful and encourages smoking cessation. Out of 100 non-diabetic patients with moderate to severe periodontal disease who were successfully treated, when evaluated a minimum of 15 years later, only 2 patients developed diabetes mellitus, which begs the question, does reducing the overall inflammatory load have a very positive effect on preventing diabetes? And on the average, patients with a total score of a 4.63 or less tend to never lose a tooth. Which leads us to use this little ditty which patients understand. Somewhat corny, but very effective. If you want to keep your teeth alive, keep your MMPPI below a 5. Where can I learn more? You can go to my web textbook, www.pdmillerswebtextbook.com. Please note that it does have an S in it. There are 2 videos, lectures on the MMPPI. The first, as I said, is the background and development, and the second one is the clinical application. Also on there is a lecture on smoking cessation counseling, which has proved very effective. How can this index impact your practice? First of all, a greater percentage of new patients will accept treatment because for the first time they have a good understanding of what can be accomplished and what the outcome or prognosis can be. Second, a higher percentage of patients will complete treatment for the very same reason. Third, when the score sheet is shared with family and friends, you will begin receiving self-referred patients, something that we all desire. Typically, there is an improvement in oral hygiene and compliance in the maintenance phase of treatment as well. It begs the question, does a patient deserve to be informed of their treatment options other than extractions? Personally, I think they do.